Welcome to Basic EKG Interpretation with Nurse Jess. Now, before we dive into the steps I use to understand EKGs on NCLEX, first you need to understand the anatomy of the heart. Remember, the heart is a muscle with an electrical system. So over here we have our muscle, and down here we have our electrical system. If we're looking at our muscle, we know that our heart is divided into 4 different chambers. Our top 2 chambers are called the atriums, right and left. As you can see, they're in pink. And our bottom 2 chambers are called our ventricles, right and left, as you can see in dark blue. Now, how do these muscles contract? They contract due to the electrical circuit of the heart. So our electricity originates here in the sinoatrial node, or the SA node. Electricity is sent from this node through the atriums that cause it to contract, and then they are placed right here in the atrioventricular node. The AV node will hold on to that electricity for a fraction of a second, and then it's going to send it through the ventricles to tell the ventricles to contract. Now, how does that electricity look on an EKG strip? We're going to start with our P wave. So when our atriums depolarize or contract, we're going to see a P wave, as you can see in pink here. They are small, uniform, and they come right before our QRS complex, which is our ventricular depolarization or contraction. Lastly, we're going to have our T wave, and our T wave is when our ventricle relaxes or repolarizes. This will come after QRS. Now, stay tuned for more. I will be posting part 2 tomorrow.